Good evening, Alice Peplow from the Malta Parkinson's Disease Association from Mater Dei Hospital, together with Mr Ludvic Zrinzo, Senior Lecturer and Consultant in Neurosurgery, and Dr Neville Vassallo, Senior Lecturer and Researcher with a special interest in Parkinson's at the University of Malta. Dr Zrinzo, you have just finished giving a very interesting talk on the subject of surgery for Parkinson's, what every patient should know, wherein you spoke of the deep brain stimulation treatment. For the benefit of our listeners, would you kindly give us an insight on this talk, please?
Well, first of all, I'd like to thank the Malta Parkinson's Association for inviting me here. It was a real pleasure to meet with the Parkinson's patients and their families. And I'd really encourage people to join the Parkinson's Association. I work in London and I do a lot of good work with the UK Parkinson's Association. And there's definitely strength in numbers. And having an association that raises awareness of the illness and bringing people together who have similar experiences can help each other during difficult times. The talk that I gave was really focusing on what patients should know about surgery for Parkinson's disease. As we know, there are lots of therapies that are very effective in Parkinson's disease: keeping active, mental exercise, physiotherapy, dance therapy, speech and language therapy, and of course, a huge number of very effective drugs. However, when drugs don't give the desired quality of life, then perhaps we should be looking towards other therapies. And surgery is a very potent and a very powerful way of helping selected patients achieve the quality of life that they desire and to improve the motor symptoms of Parkinson's disease. The surgical therapy that we discussed most about today was deep brain stimulation. This is an operation that involves placing very small electrodes, wires, deep within the brain to change how the brain processes information and as a result improve the movements of patients with Parkinson's disease. This is not just an operation, it's a lifelong therapy. And I think after today's talk, I hope that the attendees understand a little bit about what Parkinson's disease is, how it affects the brain, how doctors can help patients with this illness, both in terms of the medication and in terms of surgery. One of the things that I mentioned in the beginning was how Parkinson's disease develops in the brain, and that's really an interest that Dr. Neville Vassallo is looking at the molecular mechanisms within the cell that lead to damage to the cells and to the eventual death of some of them.
Thank you. Dr. Vassallo, what's the current state of the research on Parkinson's, and can you brief us on this research which is currently being carried out at the University of Malta?
Very well. As Mr Zrinzo was just saying, the next step in research on Parkinson's disease, the next big important step, research on Parkinson's disease, is to try to address the root cause of the condition. So that we can therefore develop what we call a disease-modifying treatment. That is a treatment which is not just going to improve the symptoms or signs of the patient, but will actually address and slow down the progression or halt it, stop it altogether. Today we have much more knowledge on what's happening in the brain of a patient with Parkinson's disease. For instance, we know that one important thing that's happening is that there's a brain protein called alpha-synuclein, which tends to form clumps. It starts forming clumps in particular areas of the brain, called the substantia nigra, and as a result of these clumps, the neuron starts to die off. So one definite strategy to active area of research is to try to find drugs which can like sort of clump busting drugs which can break these clumps which have already formed, or even better, prevent them from forming in the first place. If we get to the stage when we have a drug like that, we would definitely be a step. It would definitely be a step forward. As to the research we are doing here, in fact, is on those lines. In Malta, I lead a research team which we've been involved in the past six years in this area. We collaborate with a group in Germany in Munich, and we in fact have identified a promising one such compound which has given us very good results in the early stages, like in molecular. So first you have to test this at the molecular level, at the cellular level, then in animal models before you go on to the patient. Because before you go on to the patients, you really have to have very good evidence that this drug is working on the mechanisms, and that's our bulk of our research goes into. So that is more or less what we do. Obviously, I cannot say, it's unlikely that this to develop a drug till the end stage, so till it's available on the counter for the patients. It takes many years. So, but this is the first step, and we're there.
So you'll be in your job for many more years to come, Mr.
I look
Zrinzo.
forward to the day when I can retire. It would be a wonderful thing if we could prevent disease progression.
Right, just to finish off our interview, what are the new challenges with regards to surgery in PD which are in the pipeline?
Yeah. So one of the things that I emphasized in my talk today is that although surgery can have quite striking effects on the motor symptoms of Parkinson's disease, it is by no means a cure. As Dr. Vassallo was saying, it doesn't prevent the progression of the disease. However, it's a powerful tool that together with drugs can keep symptoms under control for many years and even decades after the surgery. That is not to say that new symptoms cannot develop after the surgery, and in fact one of the biggest problems that we have is development of non-motor symptoms. So Parkinson's patients don't only suffer from tremor and rigidity and stiffness and slowness, but they can also develop problems with their mood, and many patients with Parkinson's disease are prone to getting depression, for example, or even with cognition, how the brain processes thoughts, and early on it becomes difficult for patients to multitask, to do more than one thing at a time, and later on it can in select patients progress to something called Parkinson's disease dementia. So one of the things we're looking at in the UK is we're doing a trial of whether placing these little electrodes that we use to control the motor symptoms of Parkinson's disease, whether placing them in a different area of the brain, specifically called the nucleus basalis of Maynard, to see whether we can drive those cells to produce more of a drug called acetylcholine to improve the cognition of patients who are struggling with those aspects of the disease. It's very early days. We don't know whether this is going to work, but these are the sort of challenges that we have, both from trying to treat the symptoms and, of course, from trying to treat the underlying problem at the molecular level. So Neville and I were at medical school together, and it's really quite lovely to see him again here, that we're trying to tackle the same problem from two different angles. And I hope one day we'll meet.
That's wonderful. My last question to you, Dr. Vassallo. As we were speaking earlier, you mentioned the problem of pounds, shillings and pence, which comes to everything nowadays. Could you give us a comment on that? What actually it entails to carry out this research?
As you can imagine, such high-level research requires a lot of money. Money for the infrastructure, money for consumables, money for the actual people, the scientists. So I would make an appeal for people to give funding for research in general, but obviously especially particularly in our area. I think giving money for research is a very noble thing to do, actually, because the advances in science come out of doing new research. So I think ultimately it's something which is a noble thing to do.
Well, thank you very much, both of you, for your contribution, and also thanks to our listeners for their interest. Please visit our Malta Parkinson's Disease website to learn more about our association, and we would love it if you could actually visit our Facebook and put a like on it. Thank you very much. Good evening.